What's going on, American family? Welcome back to our channel. I'm Andrew.
I'm Free.
And we are
The
TheGhaMericans. So I saw an article online with the title written Mental Health Emergency in Africa. And this got me thinking. And so I reached out to my wife, Free, and spoke to her about it. And also wanted to find out how mental health has been handled in the United States. And so we decided to make a video on this topic. But before we get right into the video, we want you to like, comment, subscribe, and share, and also hit the notification bell so that anytime we make a post, you will get updated. Let's get right into it. So growing up in an African home, mental health was not discussed. In fact, lots of African families never discussed mental health. And persons or family members who had mental illness were discarded, because they didn't want to associate themselves with these people thinking that it was spiritual. And so growing up, I used to see a lot of mentally ill people on the road. Most people who are from Ghana would attest to this fact. You can be chased eventually, even be chased by a mentally ill person whilst you're going to work, going to school. So it got me thinking, back then, obviously I didn't know that there were challenges when it came to mental health in Africa. But now that I'm old, I've been able to identify a few issues, a few reasons why mental health is not being promoted to its maximum in Africa. And so in this video, we're going to throw more light on some of the reasons why mental health is not being promoted properly or well enough by people in Africa. So the first reason why mental health is not being promoted effectively, in my opinion, on the beautiful continent of Africa is because mental illness is regarded as a taboo in most African countries. In fact, when someone complains of depression, complains of, not being able to function properly because of, anxiety or any form of mental illness, they will say, oh, you'll be fine. Let's go see a doctor. Let's go see a pastor. Let's go for deliverance. Let's go to church. Let's pray about it. Not knowing that mental health is actually not spiritual. It's not spiritual. I don't know. Have you heard of any stories of people complaining that, oh, I had depression, I had anxiety, and all they could do was take me to the pastor or something?
Yes. I feel like most of the time it's just discarded, especially I would say like from our generation. It was kind of like if you went to your parent and said like, hey, something's wrong with me, I'm depressed, I have anxiety, maybe you're sleeping a lot. A lot of times it's seen as like, oh, nothing's wrong with you, ain't nothing wrong with you, you need to do this or you need to do that, or go to church or pray about it, or something like that. And then sometimes depression, or if you're sleeping a lot, or if you have anxiety, or if you choose to just kind of be to yourself just because it's seen as like, oh, you got an attitude, what you got an attitude for, why are you mad, you shouldn't be mad, like that type of thing. It's like totally just discarded. And I feel like now there's much more much more focus on like mental health and things like that. But back then, like, no. And most people, like, they probably didn't even know they were depressed, or they had anxiety, or they had true. Whatever underlying issue. It's just Yeah,
that's true. And in most African communities, anyone who commits suicide is seen as being possessed, who was possessed by an evil spirit, not necessarily identifying any underlying mental illness fact. Exactly. And so they'll be like, oh, let's just take him to the traditionalist. Let's take him or take her to the pastor or something like that. And in most cases, they don't even, take good care of the person who's actually ill. They would say, oh, family members, let's cleanse you all from this evil spirit, or this curse that has befallen your family. In most cases, that's what happens. Yes. And so either they're going to ostracize this mentally challenged family member, or you're just going to, dump them somewhere and forget that they exist. Just so they don't incur certain curses on them.
Yeah, I feel like now that, we've been doing these videos and we've been talking, I feel like with Africa and Africans, I guess you could say that everything is like spiritual. It's never like it's never like there's an actual problem. It's just chalked up to it being like, oh, this is like spiritual like, what is it, welfare or what? That's it,
warfare, spiritual warfare.
Yeah, like spiritual warfare or something like that. So I'm starting to notice that trend.
Yeah, and it's quite unfortunate, but I guess it is what it is. It's unfortunate.
Yeah, I can definitely say in the U.S. now there is definitely a lot more is being put into like mental health and things like that. But I feel like it started with our generation. I can say for like our parents' generation and the generations before that, I've already mentioned that it's kind of like, oh no, you need to pray about it, you need to go to church, you need to do this and do that. But I definitely feel like in our generation, people are literally taking the steps to like seek help, like literally like medical help in terms of like mental, health issues, which I think is good. There have been a few people that I've, had known since like middle school and things like that have like committed suicide. And it's like, oh my gosh, like people didn't even know that it was that bad. So now it's like, if you need help, go get it. Our generation, we definitely like are advocating to like get help if you need it. So.
Oh, wow. And quick story. So when I was in college, the medical school, there was a student who committed suicide due to depression and stress of having tons of workload. And unfortunately, this person was reserved. They were an introvert, and nobody knew what was happening until after 3 days when the body started decomposing, and then the smell brought the attention that, oh, there's something going on in this person's apartment. And then they checked and it was like, he had actually committed suicide. But prior to that, he confided in someone that, oh, he's not feeling well, he's depressed, he's stressed, spoke to his parents about it, but they were like, oh, you'll be fine, everything will be fine. Even his friend, the person he confided in was like, oh, you'll be fine, let's go to church, everything will be fine. It was after the fact that they came out and said, oh, he actually said that he was depressed because he failed 2 courses and he didn't know how he was going to handle the rest. And it's unfortunate, but yeah, we have to do more in terms of that and remove this ideology that mental illness is a taboo. So the second reason why mental illness is not effectively promoted in Africa is lack of resources. So in Ghana, our yearly budget, every year the president will address and be like, oh, budget for the year and all of that. Guess how much money is allocated to mental health? Percentage.
10%?
If it was 10%, trust me, we would have done a lot. Nope. 1.5%.
Oh, wow. Okay.
1.5%, which is appalling. So imagine, how would these psychiatric hospitals be equipped enough to take care of people who are mentally challenged? In Nigeria is regarded as one of the biggest economies in Africa. Guess how much they allocate for mental health?
About the same?
3%.
Okay.
For over 350 million population, they allocate just 3% of their resources to take care of mentally challenged people. How would they be able to overcome this challenge? It will be impossible. Do you know how much money in the US is allocated for that?
See, I don't know, but I do know that now with insurance plans, in America you have to have insurance to get help, or you're not going to get much help. But I do know that now insurance plans are starting to cover like mental health, like services and things like that. Yeah, from my understanding, I haven't worked in America in almost 5 years now, so I'm sure a lot has changed. But I do think like, you can have health insurance that actually allocates money towards like seeing a therapist or.
That's impressive because from my understanding, I don't know for now, but when I was in Ghana, there was not like that. There's insurance even doesn't want to pay for things that for
that
tragedies
don't seem necessary.
So they don't even cover mental health. And of course, the mentality that we have that is a taboo. It's this obviously
it's not important.
It's not important. So they would not allocate funds to cover that. So if you want to go see a psychiatrist, you're on your own, and that's why seeing a psychiatrist is expensive. Charge them per the hour. most people will not be able to afford that. So what would they do? To just sit down, and then over time their illness will deteriorate, and it's unfortunate. So yeah, lack of funds, lack of resources in most African countries is a reason why mental health is not really promoted that much. So the third reason, and this is very important, this is like the center, you know, the reason why most people, when they have mental illness, do not even want to tell people that, oh, I'm depressed, I'm stressed. It's because of the stigma attached to mental health. When you tell someone that I'm depressed, I feel like I don't want to do anything, I just want to be left alone, I want to...
Or I'm having like, you know, thoughts of harming myself and things like that.
Like I hear voices, you know, or they say you're crazy or you're this, and it's they tend to spread the news.
Yes.
No matter who you speak to, you find out that you just spread, especially if you're in school, you're at work, your colleagues will spread the news. Everyone is going to know in the community that, oh, this person has been hearing voices, this person is being attacked, is being what's it called, controlled by demonic spirits, you know. And so the stigma attached to that, a lot of people will just keep quiet, you know, and then at the end of the day, when it's worse, they either commit suicide or they harm someone. So that's why stigma attached to mental health in Africa is serious. And I don't know how we'll be able to manage or maneuver, but hopefully you and I can do something to change that narrative. You know, in Africa, we have to come together to change the narrative. I know it's in Africa, like there's a movement to push people to go for mental health care and all of that, and to remove that stigma that is attached to mental health. And it's good. It's really nice to see that that movement going on in South Africa. So what do you think, in your opinion, how we can change some of these narratives and help improve mental health in Africa?
Again, just being open-minded about the situation in general. Again, if I'm confiding in someone and telling them like, hey, I'm not doing good mentally, this is how I'm feeling, you know, I want to harm myself, I feel like I want to harm others, you know, I feel like we should be like more open and receptive to that. It's kind of like, you know, growing up like in, you know, Black household, it's like if you were to tell your parent like, hey mom, I'm feeling depressed, I have anxiety, you know, they would literally get on the phone, yeah girl, to their sister, yeah girl, talking about she got anxiety, she ain't got no anxiety, she better anxiety them dishes, you know, it's like you know, it's like that
anxiety
kind of
those
thing.
Dishes.
yeah, you better anxiety those dishes, you know, anxiety that room. You know, people just have to be like more receptive, you know, when people are coming to you and telling you like, hey, this is how I feel, like take it serious, because people can laugh and they can smile, they can be the happiest person in the world, and then the next thing you know, like they've taken their lives and things like that. So and I even remember like years ago, you know, sometimes people, they don't have anyone to vent to, so they get on social media, they might make a post or whatever. And I remember this one guy, he would always like make statuses and things, be like, you know, life can't be that hard and you can't be going through that much stuff, blah, 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 blah. But the thing is, like, he has lived a privileged life his entire life. He's never had to worry about anything. He had a car when he was like, you know, 16, and he got every pair of shoes and things like that. Like, he never had to worry about anything. So of course that's easy for you to say, because you don't have all these other factors and things, you know, weighing you down. And it got to the point where I think maybe like two guys that we had gone to middle school together, they ended up like committing suicide. It was like his whole tune ended up changing. Oh, if you have, you know, if you're having any issues, you can reach out to me and talk. No! If I did have an issue, I'm not reaching out to you because I done already saw, what you've been posting.
That's true.
You know? And it wasn't, I guess, until things hit home for him, because again, we had known both of these guys, we had gone to middle school with them, and I'm guessing he had a close relationship with him, but it wasn't until it hit home for him that he kind of was like, okay, well, you know, if you're feeling any type of way, you know, you can always reach out to me. I still won't reach out to him, not to this day, no.
Wow. So in your opinion, creating more awareness
Yeah, being awareness, being receptive, actually like giving people like resources. You can post the suicide prevention hotline on your, Facebook page or social media page, for people that may be scared to actually reach out to them, like giving resources and things like that, actually helping people, calling a person up just to say, hey, how you doing? Especially if you know that person is, struggling with
and speaking of hotline for suicides, I'm not so sure, but if you know if there's any hotline for suicide, people feel in Ghana, from where I am, or in any country, which country where you come from, please let us know so that someone, reading the comment section will be able to reach out to these people. Because in Ghana, I don't know if they have a hotline. I have no idea, but if you think they have a hotline, please let me know in the comment section. Also, I think that maybe the government should also do more.
Yeah, 1.5%.
Yeah, 1.5% is not going to cut it because now the stress coming from the pandemic, a lot of people have been depressed. And so the pressure on the psychiatric hospitals is a lot. And they do not have enough funds, enough beds. In fact, you go to a psychiatric hospital, it's like a little box somewhere, They need more funds and resources. So I think if the government is able to allocate more funds, it should help.
Yeah, I think COVID, it hurt a lot of people. I kind of sat down and thought about like all of these countries that rely on tourism.
Yeah.
The people that drive Uber, the people that, take people around on tours and things like that, people that drive tuk-tuks, people that, they literally
live on interaction with people.
Yeah.
That's how they make a living.
Yeah, even when we lived in Shanghai, there was like, it's called the fake market, y'all. The fake market legit closed down because it relied so heavily on tourism and people, if you're not selling anything, you're not making any money. So I can definitely see how that can impact people, even like just having to isolate yourself and be by yourself. You can't go out, you can't see your friends, you can't do things and live life how you were living them. That has a big impact on people.
So I just want to say this to end the video, that if you're an African somewhere and you're depressed, you find yourself in a dark space and you want to talk to someone but you're scared to do so, I encourage you to do that. Reach out to a professional to help you because according to studies that so many deaths in Africa by suicide has skyrocketed over the years, and this was partly also influenced by the pandemic, the COVID-19 pandemic, and a lot of people committed suicide. And so you might think your depression or your anxiety is nothing, but I would entreat you to see a professional to get yourself checked in order to prevent any catastrophe from happening. All right, to end the video, I'm Andrew.
I'm Free.
And we are TheGhaMericans. Catch you guys in the next video. Bye.